Advantage Athletic Therapy, personalized rehabilitation programs with a whole body approach. Enjoy the podcast.
We have an eye appointment with Dr. Amber. How are you?
I'm good, Dave. How are you?
Good. It's been a while since we've chatted. Hope things are well. I hope the kids had a great March break and you're back at it hard, of course, like always. I want to talk about two things today. First of all, eye drops for dry eyes and allergy season. So both are right there. And there seems to be some confusion sometimes on which are which. I know my wife, she has dry eyes quite a bit and she has to use drops. And I was just curious, is that a good thing? Like, what should you be looking for? So let's start with the eye drops.
Okay, perfect. Yeah, actually, this is a great topic for this time of year because, the snow is melting and the ground is thawing and trees are budding. So, I see a lot of people coming in, their eyes are kind of itchy, watery, irritable. Allergy season, it's can really affect your eyes. And it's tough to know, is it allergies that are bothering me or are they dry? Um, for dry eyes, eye drops are kind of the mainstay of treatment. So it is okay to use eye drops. Um,
Okay.
yeah, so you can let Monica know that that's fine to use eye drops.
Sure.
Honestly, most people, if they do need eye drops, they're not using them often enough. So if,
Oh,
it's important to get your dry eye diagnosed. Go in and have an eye exam. Your optometrist can tell, are your eyes dry? Is it something different? Is it allergies? Is there something else going on? Are there underlying things that need to be treated and other ways it needs to be managed? But if eye drops are the answer, most people don't use them often enough because your tears evaporate pretty quickly. So using eye drops 3 or 4 times a day, if eye drops have been recommended to you for dry eyes 3 or 4 times a day, that's not too often. That's usually a good frequency to try and aim for.
so what is, just curious now, you were telling me that there's like different layers or like you have almost like a slime you said on your, like there's an oil and a slime. Like what can you,
Yeah,
sorry folks,
yeah,
I was just curious because when you told me this, I was like, I didn't know. I just felt like it was watery. I didn't know what it was, but
yeah.
can you
Well,
just give us a little insight?
yeah, for sure. So, when most people think of their tears, you think of what you get when your eyes water or when you're crying, that it's, really liquidy and runny. But actually, your eyes stay wet all the time with a layer that's a little bit thicker. It is made up of several different layers. You've got oil in your tears. That's produced by little glands that are along the edge of the eyelid. So every time you blink and your eyelids touch, it's drawing oil out of those glands and spreading it across the surface of your eye. You've got mucus in your tears as well. So uh, natural, it's clearish whitish mucus. It's in a pretty thin layer, so you won't really see it on your eye. But yeah, your eyes they're kind of wet with like a slimy layer, not necessarily what you get when you cry. So sometimes eyes are dry because you're missing, a bit of oil, or you're missing a bit of mucus, or there's just not enough of all of those three components together. But eye drops are replacing some of what you might be missing. So knowing which eye drops are best to use for your specific type of dry eye is important.
Oh, and I suppose there is different types, isn't there, of eye
Yes.
drops? Like, is
Yep.
there certain strains of potency, I guess? Would that be a thing? I don't know.
Yeah, so some eye drops are quite thin and watery and sort of the same
Okay.
consistency as your tears. Some eye drops will have an oily component or a component to try and replace the mucus layer or mimic the mucus layer. Some eye drops are quite thick. Gel, oftentimes, if your eyes tend to be quite dry, we'll recommend a gel eye drop. Little thicker, stays on the eye longer, and you can even get consistency right through to an ointment. So it comes
Wow.
out of the dropper or tube like Vaseline, coats the eyeball, good for bedtime, good for when you're sleeping, or if you have a condition where your eye doesn't close fully, then using an ointment lubricant can be better than a drop.
So I did never even thought of that. If your eyes doesn't close fully when you're sleeping, obviously it's going to dry out, isn't it? Huh.
Yes, yeah, yeah. And your optometrist can
Who knew?
tell if maybe that's what's happening. When we assess you for dry eyes, one of the tests we do usually put a dye on the surface of the eye, and you can see the layers of the tears, see where it's thin, see if there's dry patches on the surface, and tell sort of why they're dry, what component you're missing. Is there something else going on? Is your dry eye linked to your medications or maybe other health conditions? And get you set up on a path that's going to work for you.
All right. Let's talk allergies. It's that time of year. You're right. Oh, for allergy season. Recommendations. And I think a lot of people Like, that would be the one time I did use drops when it was, when your allergies hit, and it's just so irritating. Recommendations?
Yeah. So allergies, the symptoms overlap with dry eyes quite a bit. Allergies usually quite itchy. So if
Mhm.
you feel like you've got mosquito bites in the inner corners of your eyes, you feel like you just want to scratch them out. If they look a bit watery or puffy, oftentimes there's a bit of allergy going on. You could develop ocular allergies, seasonal kind of allergies. This year, even if you've never had them before, you could develop allergies. Some years will be worse than others, depending on, what your allergens are. Allergy eye drops, usually they'll contain some additional medications to reduce, the response to histamines. There are prescription strength allergy eye drops that can work really well, some that are a little more preventative. So we recommend them before allergy season or year round to just reduce the reaction that you get. And then there's some really good ones that are sort of immediate acute itch relief. So there's
Do
lots of options out there.
do the histamines dry out your eyes when you take them?
So the antihistamines do, yeah.
Yeah.
So
Okay.
that's the tricky thing. If you're taking allergy medications, like oral allergy medications, usually they will dry your eyes out, so they're less itchy, but now they're more dry. So yeah, it's really terrible time of year for people that deal with spring allergies, and of course,
Yeah.
some people right through the summer or they peak in the fall. So if this time of year you're starting to feel like your eyes are bothering you more than they did before, there's a chance it's allergy. And again, coming in and having an eye exam can determine what's going on.
Is sort of the medication that you guys provide for the dry eyes as far as allergies, obviously, it must be a little more potent, like it must than the store-bought stuff, I'm gonna
Yeah,
guess.
or they contain different
Okay.
different things. So if if allergies are bothering you and eye drops are just not your thing, so I know a lot of people really, they struggle to put eye drops in or they don't like using eye drops. There's sprays, there's other things you can use around your eyes, and your optometrist will have other kind of tips and tricks for you as well.
Lots of good information today. How do people get a hold of you? Where are you? Come on, give
Yeah,
everybody the
yeah.
information.
We're on Colburn Street North in Simcoe. You can find us online on Facebook and Instagram. You can find us at simcoeoptometrist.com. Check out our website, check out our social media. Give us a call, 519-426-3123.
Hey, the one we did a couple of months ago on babies too. Thanks for doing that because I did get a little bit of feedback, and I do appreciate folks letting us know that they do appreciate that information. So, that was a fun podcast. You can check it out, and it's in our library of many, many podcasts, and you can see and get that information as well. Thanks for talking about the allergies and the eye drops because I didn't even realize you could take them 4 times a day. To be honest with you, it probably says on that, but with my eyesight, I can't see it.
Yeah, and
But yeah,
yeah, sometimes people need them more than that. So, but then
yeah.
you
Make
should really
sure.
make sure the one you're using is okay to use that often. So the eye exam's the answer there for sure.
All right. Thanks for doing this, Dr. Amber. Take care.
Yeah, you too, Dave. Bye for now.